do not want to make use of all the time. So I'll quickly hand over to Jeff to take us through the introduction of the Learning Hub. Jeff, over to you.
Thank you so much, Rachel. So before we proceed with our first session for this webinar, and thank you so much again, everyone, for attending. This first webinar is not only important for all of us working under the KELD project, but this is also a really good learning process to begin our understanding about pandemics and also understanding how it can be integrated into the current project activities that we are undertaking. So for this first webinar, first of the 4 webinars that we will be conducting for this year, this first webinar will include, of course, the discussion, basically a 101 of the pandemic within the context of disaster hazard and public health emergency. But before that, I would also like to introduce what this KELD community of practices or learning hub. And then after that, we'll have a presentation of the political declaration. As you all know, the 2023 political declaration on the pandemic preparedness, prevention, and response has been adopted last 2 weeks ago, September 22nd, and it has been fully approved and then fully adopted just yesterday during the UN General Assembly. And then after that, we'll open the forum for some question and answer. At the same time, also, we will post any questions that we will have to discuss and answer as we move along, and then we'll close the webinar. Okay, so to begin our first session, let me just share with you this. So this is I hope everyone can see the screen. Let me know if you're not able to see the screen. So this is the Community Engagement and Leadership in Pandemic Governance, or KELD Learning Hub, our community of practice. And what you can see on the screen is actually our website. So this learning hub, the objectives of this learning hub are 2 things. The first is to provide a space for all the project partners and implementers to have a space to share the experiences, the activities that you are currently conducting, and actually learn from each other in terms of conducting these activities. We are focusing on, okay, thank you. We are focusing on specific last mile populations, TDK and vulnerable populations under each of the countries that we are engaged in. So it would actually be wonderful to use this space, the community of practice or the learning hub, to share those experiences and also share the outputs that we will be producing from our project activities. The second is eventually, maybe halfway through the implementation of the hub, we will be opening the hub to a community of learners. So who this community of learners are? So these are organizations, individuals who are probably interested to participate or are already participating in the pandemic governance or in the implementation of PPPR, if there's already something that's already going on at the country level, to learn more from the implementers, from the practitioners, which is us, and also the country partners, and also those who we are engaging at the country level. So those are the 2 objectives of this learning hub. So this learning hub will be hosted both by ACT Africa and also ACT AP, hosted by APCASO. And in this learning hub, of which you will also see on the website. So this will contain 5 different areas of platforms, or ways to engage with the learning hub. So the first one is, of course, this lessons webinar. So these 4 webinars that we are conducting, this being the first one. So we will have these monthly webinars. For this month, we'll have 2 webinars, lessons webinars, which will have specific focus in terms of the topics around pandemic governance, around PPPR, and also around the implementation of the projects that we are currently conducting. So those webinars we will be uploading soon, including this one. That's why it's also recorded in under this latest videos, so that those who may have probably skipped or weren't able to attend this webinar, you can always go back to this, to the videos. The second, which is actually very interesting, would be the discussion forum. So you will, when you visit the site, and later I'll share the link to you, when you visit this site, you can not only see the website itself as a repository of the different materials, but you can also participate in the discussions. So when you click on the discuss, it will actually bring you to a specific website where you can register yourself. So I would encourage our partners who are here today to register already, so that you can participate in the questions. Our facilitator, Jerry, who I will introduce later, will be facilitating this discussion forum. And that discussion will take place not only in between the different webinars, in between the conduct of the webinar. So after this webinar, for instance, we will be posting 1 or 2 questions for you to participate in. We will be sending those and alerts to you once those questions are posted. So I'd really encourage you to participate in the discussion forum. The third one is actually the videos. So apart from the webinar itself, which is live, like what we're doing today, the videos I already mentioned, it's more of a passive learning process, which you can visit the website anytime. The fourth is the events. So you will see in the events, like for instance, in this particular example, so our first webinar is here. When you click the events, you can already see the details of the events. Eventually, when you share with us your reports or your activities, we can post those activities here, so that we can only not see the schedules of the webinars, but also the schedule of the different country level activities that you will be undertaking. So we will post them all up in the upcoming events. And last but not the least, all of you are conducting your mapping activities already, right? So in the mapping activities, those mapping under the about KELG section tab, we will be posting this. You will be able to access this map from Google. When you submit to us the results of your mapping of the different organizations and the different partners that you've included in the map, we will upload their information. Of course, depends on the consent as well. That's why, remember, in our early discussions about consent, we need to make sure that the organizations are giving consent as well for them to make their location more public. So we will be using those information to pinpoint their location in this map. So eventually, this map, it's currently in Thailand because I'm based in the country. We will have different points here locating the different organizations that you've identified in the mapping exercise that you're currently doing. To recall, the purpose of the mapping exercise is basically to identify the different organizations that are working on specific populations that you're focusing on. Also, those organizations who will be engaged in the pandemic governance, or we will be engaging in the pandemic governance. We'll be inviting in our different activities, for instance, different advocacy activities, different campaigns, etc. So you will also be able to access not only your country's directory, but also the other countries' directory as well through this KELG Learning Hub. So that's the Learning Hub. I will post the link to the Learning Hub now, so that you will be able to explore it further. Currently, there's nothing much in there, but as you submit your reports to us, we will be able to post it on the Learning Hub. Yeah. All right. I guess before we move on to the actual meat of our webinar, I wonder if anyone would have any questions, thoughts, or comments, or at that very top level, how can we improve the design, the look, is the overall look? Any thoughts? If none, then I hope you will be able to utilize the webinar, sorry, not only the webinars, but actually the Learning Hub itself, as we populate them with our outputs, and you can visit it regularly as part of your work so that you can also see what's in that Learning Hub. We plan to keep the Learning Hub alive and continue its existence even after this project. It is a repository of all the work that we will be conducting under this project, so it would be nice for it to stay as this. Paul, I see your mic is on. Do you have any questions or thoughts to share?
Yeah, I was just in the platform you are sharing to us. Is there any kind of live conversation that, let's say, one-to-one, we can exchange ideas immediately, and then somebody can respond, So is there an opportunity of live conversation on that platform, that webinar thing? That was what I wanted to ask. Yeah.
I mean, the webinar during the webinars, definitely you can actually post those questions already as part of the discussion. If you're looking for a live one-on-one, my suggestion is really to reach out to your focal point, no? So it's gonna be either me or Rachel. You can also use the discussion forum on the website to post your questions. It's not going to be live, but at least your questions are already up there. Jerry, our facilitator, will be monitoring the discussion forum regularly, and we'll be responding as well to any questions or queries. So those are the 3 avenues that we have in terms of with regards to your question. So I hope that will be helpful. All right. So have a look at the website. I already posted the link on the chat box. And if there are no further questions, then we can move on to our next session. So our next session is the pandemic, or sorry. Yes, Olive, go ahead.
Thank you so much, Jeff. And I'm so excited to see this great work that you guys have done. And congratulations to the team for putting this together. I had a question. I wanted to know, like, for the country partners, if they will have some information or a document they want to put on the hub, who do they contact? Who do they get in touch with? And at the end of like, how often is there like a summary that will be coming from the hub itself? Yeah, thank you. Back over to you.
Thanks, Olive. So in terms of uploading the different documents and outputs, so the documents can be sent directly to, so at least for the Africa partners, it will be Rachel, and Rachel will send it to me. For the Asia partners, it will be sent to me directly as well. And then just a simple caption on what the document is about, so that we can immediately upload it on the site. In terms of documentation, so the website itself it's a living document already, of a repository of the work that we're doing. Of course, there's also the project related output that is expected. We will be writing up something and include this in our reporting as part of the regional reporting. So we'll have that also. Let's see towards the end of this project if there's a need to have a separate documentation as well on the process of facilitating the Learning Hub, the experience of the facilitator, the experience of the users also. Let's see if there's something that we can have a write-up on, apart from the project-related deliverable that we will be submitting. Yeah, that is something that we can explore. And then, Olive, I saw that you have a question here for the GeoMap. Do partners need to get the coordinates as they collect information? Yes, so we discussed that already in one of the earlier calls, that in lieu of not being able to locate them on Google, we have to get the coordinates. In some countries, they will be getting the coordinates, so we'll be able to locate them through the map. Yeah, we will try it as we move along. And if there are any questions, or if there's difficulty to actually pinpoint the location using Google Maps, using the coordinates that will be submitted, then we'll reach out to the country partner directly to see what goes. Most of the time, it's usually Google now compared to previous years is quite accurate as long as you have the coordinates. So let's see. Thank you, Olive. All right. So I'll now move on to our next session, which is the Pandemic 101. This is actually a very interesting session. I've seen the slides earlier, and it's really quite interesting, also for me as well. So without further ado, let me call on our facilitator, Dr. Jerry Alejo. He's based in the Philippines, and he is a medical doctor by profession, but he's also a nurse, and he has a strong background in community engagement. His academic background is really about community engagement and public health, and he's one of the people I know who has that kind of, a living, like an embodiment of a nexus of public health and community engagement. So his entire contribution for this KELD project as a facilitator would be really substantial and helpful for us. So I hope we can learn more with Jerry having as a facilitator for this specific project. All right, so handing it over now to Jerry to orient us on pandemics. Jerry.
Hello, I feel pressured. And I don't know about being someone who knows a lot about community engagement. I think you have more, every one of you has more experience regarding that, but I'm a medical doctor in the Philippines practicing community health. And Jeff asked me, one thing that we talked about when Jeff introduced me to the project was he asked if I think that the COVID-19 pandemic was a disaster, because you were talking about, or we were thinking, how will we frame pandemics for the discussion and for the rest of the webinars? So I thought that in my thinking, the COVID-19 pandemic wasn't really a disaster. However, it would have become a disaster if there were problems with management of the risks of the pandemic. But before we go with the actual presentation, I would like to ask one question first, and I will be posting it. I will post the link so that you can answer it on the chat box. I will give you about 5 minutes to get your responses, because this will help Global Fund in preparation of their future projects. Here's the link. It's on the chat box. If you can see it, the question is, what are the main challenges that hinder most impacted communities from engaging in pandemic or emergency response? Again, the question is, what are the main challenges that hinder most impacted communities from engaging in pandemic or emergency response? I will be waiting for your answers.
For those who cannot access Jamboard, you can also let us know via chat box your answers so that we can post it on Jamboard later on. Anyone?
One. Or on the chat box, you can place your responses on the chat box.
Let's try and ask for some people. Let's see.
Okay, it's still downloading. Well, you can put your answers in the chat box and we can just read it.
I
If it's
see.
easier for you.
Let's try and call on people. For example, Chantorn. Chantorn. So, in your opinion, what are the main challenges that hinder most impacted communities from engaging in the pandemic response, especially learning from COVID?
Okay, thank you so much. I think from our experience, especially during the COVID-19, the one thing and also very important is about the, how to say, the capacity of those, affected people, because COVID-19, pandemic seemed to be very new for them. So it's like it was not, well prepared for them, to get engaged, to take response or to contribute to the response. I think this, the one thing that how to say we face. So that's why during that time we provided, many activity or initiative around capacity building. I think this is one thing that we face and also we experience with. Over to you, Jeff.
Thank you. So limited knowledge on how to engage. There are some responses also that are showing in the chat. They're not empowered to engage. So perhaps, Jerry, we can write those. Lack of information about pandemic response. Yeah, what do we actually mean when we say pandemic response? Lack of knowledge of the correct structures to go to be involved in pandemic response. We learned during COVID that most of the structures have been restructured based on the current one. No, everything has been siphoned to COVID. Paul said knowledge gap. Oh, sorry, Jerry. Yeah, someone said that so Shine from the Philippines said that they're getting view only access. So maybe if we can share, or maybe later. Yeah, you can share it to everybody. Or change the change from the viewer. Yeah, this one. Oops. This one, viewer on the right. No, the one across. Yeah.
Okay. Yeah.
To editor.
Okay, sorry.
Yeah, so people will have access. Thank
Okay.
you. Lack of local support. And then resources.
Thank you very much for your responses. I think those are all valid, having worked in a small community at that time during the pandemic. I most often lack the necessary structures to participate in decision-making processes. I agree with that. Having in our system in the Philippines, we're very the health system is very disorganized, fragmented, and during the pandemic, in times of emergency, decision-making usually comes from the top level management. In this case, in the case of pandemics, a lot of the guidelines would have to come internationally from a global governance structure going down to the community. So, and I think in our time that this is the first pandemic that affected everybody. And that makes everything new to us, including pandemic responses and pandemic governance. That's why when we developed the webinar, Jeff and I talked about having and discussing pandemic responses and pandemic readiness first as a framework for our discussion on how to engage communities and empower communities to engage in pandemic response. So I'll be going now to the presentation. How do you change?
You want me to screen the present? Okay, there you are.
Okay. So my topic is the basics of pandemic governance. And the goal is to find spaces for inclusion and participation in pandemic risk preparedness and management towards system resilience. I'm assuming, since this is my first time to be working with you guys, I'm assuming we're all public health workers, either through advocacy, through service provision, through working with communities. So I'm thinking that we're all part of the public health system globally. For this presentation, this will be my outline. First is understanding pandemics as a human security threat. Under it, we'll be discussing what is a pandemic, how is it different from other hazards, how is it different from a simple illness, and what makes a pandemic a global health hazard. The second part would be understanding how to develop system resilience, both organizational as well as at the macro level up to the global through pandemic risk management, developing system resilience through pandemic risk management. I'll be defining resilience for your organization and for other health systems, and how do we develop system resilience through this disaster risk management and governance. And then lastly, since COVID-19 was just recently announced as the pandemic being done early this year, we're still developing the lessons and seeing how well or how better we can prepare for the next pandemic. So we'll be looking at new lessons regarding strategies in strengthening health systems reliance at the level of local communities, local organizations, up to the national and international level, wherein we'll be talking about or introducing pandemic instruments, which can be spaces for inclusion and participation in pandemic preparedness, risk, and response. Do you have questions so far about the topics that we'll be discussing? If none, then I'll be proceeding next. So understanding pandemics as a human threat. So as of October 4, 2023, there have been 151,224 confirmed cases of COVID-19, including 6,960,783 and 783 deaths. That doesn't include the additional deaths from other diseases that might have been caused or might have been prevented if the health systems weren't affected by the COVID-19 pandemic. That is an additional excess of deaths. That number is an additional number of deaths and morbidity if the pandemic didn't happen. And because of that amount of deaths and sickness, I'm assuming that we all agree that pandemics such as the COVID-19 pandemic is a human security threat. Since, as the UN describes it, at its most basic level, human security recognizes three freedoms to be fundamental to people's lives and aspirations. Freedom from fear, freedom from want, and freedom to live in dignity. I'm not sure if you experienced this, but as a doctor, I felt the fear during the pandemic because of most things about the COVID-19 disease was unknown at the start, and then we only had new information coming late 2020 to 2021, and then most of the fear vanished after the vaccines and after seeing that the rates of heavy illness and the deaths were going down. There was a threat to the freedom from want because of the restrictions that were imposed so that the virus will not spread easily. And then because a lot of the other freedoms were prevented because of the restrictions, a lot of us weren't able to live in dignity, especially because some were experiencing hunger because of they can't access food, and because supply chains were affected. But what is security in the first place? Oxford Dictionary defines security as a state of being free from danger or threat. When applied to human security, it's the safety from constant threats of hunger, disease, crime, and repression and protection from sudden and hurtful disruptions in the pattern of our daily lives, whether in our home, in our jobs, in our communities, or in our environment. Given the impact of the COVID-19 pandemic in the last 2 years, we can surely say that pandemics and COVID-19 was a threat to all of us and our security. especially because all of the dimensions of human security were affected by the pandemic, including our economic security. A lot of us were laid off. A lot of employees were laid off, and their income, a lot of the income was cut into smaller amounts because of the limitations in the business transactions. There were food insecurities because supply chains of food were restricted because of travel bans. There's health security because the restrictions promoted or made healthcare providers focus on pandemic and then make adjustments to the provision of basic services in the latter parts of the pandemic. There's environmental security and personal security as well. In the Philippines, there were cases of violence among those looking for food because they didn't have any supplies anymore at home. There's community security problems because there were tensions among implementers of the responses as well as committee members who feel that they were being restricted because of the responses to the pandemic. And then there was also political security, at least in the Philippines, because of abuses to those who feel like they don't need the restrictions needed for the pandemic. And it's not just to highlight it, it's not only health and health service provision that was affected. A lot of social services were restricted at that time, and because of that, the governments had to work out how to provide social services, how to ameliorate the changes and the cuts in income because of the pandemic and its restriction. So this is a report from the World Bank identifying what kind of social support were given to families and to communities by the government. This is a report from Asia. I haven't seen the report yet from Africa that's consolidated. But it just goes to show that the pandemic did not only affect health and mortality and morbidity, but it also affected the economies of the national governments. But what is a pandemic? Why is it what would cause human security to be threatened? It's because of hazards. A hazard is a process or phenomenon or human activity that may cause loss of life, injury, or other health impacts, property damage, social economic disruption, or environmental degradation. A hazard is any source of potential harm, and the WHO identifies 3 major classifications of hazards, including biological hazards, part of which is or are pandemics. So a biological hazard is a hazard of organic origin or conveyed by biological vectors, including pathogenic microorganisms, toxins, and bioactive substances, including the COVID-19 virus. They are risks to human security. So aside from the biological hazards, this can be classified according to the US CDC's top global health security risks, including emergence and the spread of new infectious diseases, ever-increasing globalization of trade and travel, enabling disease to spread, the rise of drug-resistant and disease-causing pathogens, potential for accident release, theft, or illicit use of dangerous pathogens. So these are hazards because these may turn into pandemics, which will affect everyone around the globe, like the COVID-19, like what happened during the COVID-19 pandemic. But what is a pandemic in the first place? Does a pandemic constitute a disaster immediately or not? So we'll have to discuss that. So what is a pandemic? Before we discuss what a pandemic is, let's discuss what diseases and emergencies are. Because if you look at it, the COVID-19 pandemic can be classified as a health emergency according to the definition of the WHO. But how is it differentiated from a disease or an illness? First, a disease is any illness or medical condition, irrespective of origin or source, that presents or could present significant harm to human. So a disease affects an individual, basically. Any disease or any condition can be an emergency, but not all diseases are emergencies. But what is an emergency? An emergency is a type of event or imminent threat that produces or has the potential to produce a range of consequences and which requires coordinated action. Usually, and this is what makes emergency different from a common disease. it usually requires urgent and often not routine interventions. So not all diseases will be emergencies, as you might know. And again, not all diseases will turn into pandemics. What will make a disease or a condition a pandemic? Before we go to pandemic, we'll look first at smaller cases of outbreaks or increases in diseases. A smaller type of increase in disease is the epidemic. An epidemic is the occurrence in a community or region of cases of an illness, specific health-related behavior, or other health-related events clearly in excess of normal expectancy. So an epidemic may be an increase in number of patients with diarrhea in a week within a community that does not affect another country. Or in the Philippines, Vietnam and India right now, I think we're commonly experiencing a high rates of conjunctivitis. In the clinics where I work, I see about 10 patients, 20 patients with conjunctivitis every day that require them to leave from work. So that's an epidemic. It's an increase in a disease, but only in a particular area, a particular country. Another definition would be the occurrence of a number of cases of a disease that is unusually large or unexpected for a given place or time. An outbreak is a localized epidemic within a city or within a town or within a smaller political unit of communities. So a disease affects an individual. An epidemic is a group of an epidemic is a disease that affects a small group of people in excess of usual expectations in terms of numbers. And then we have pandemic. But before we go to pandemics, there's a term that the WHO and the United Nations use. It's called public health emergency of international concern. It's an extraordinary event which is determined as provided in the international health regulations to constitute a public health risk to other states to the international spread of disease and to potentially require a coordinated response. So the difference between an epidemic and an outbreak and a public health emergency of international concern is that epidemics basically are contained in a country or a smaller political unit of the country or geographical unit of the country. But a public health emergency of international concern is an outbreak or an epidemic that has implications to the global community. So far, the WHO, the WHO has only declared 6 public health emergencies of international concern since the term was coined in 2005. The first was the influenza A pandemic, H1N1 pandemic in 2009. The second was the poliomyelitis 2014 outbreak, which I think, if I remember it right, happened in Africa as well. But there was also an outbreak in the Philippines late in the late 2020, late 2010s. The Ebola outbreak in Western Africa in 2014, the Ebola epidemic in the Democratic Republic of Congo, the Zika virus epidemic of 2015 to 2016 in South and Central Africa, and the COVID-19 pandemic in 2020. But not, if you look at the terms, not all of the public health emergencies turned out into pandemics. A lot of them were localized. A lot of the public health emergencies of international concern were just localized to certain regions of the globe, of the world. It's only the COVID-19 pandemic it's only COVID-19 that was classified as a pandemic. So what makes a pandemic? Traditional definitions from the WHO defines pandemic as a worldwide spread of a new disease. So in the one would consider the HIV and AIDS a pandemic in the 1980s. Currently, we're still having problems with tuberculosis, with special outbreaks in the countries like the Philippines. So it's a worldwide outbreak of disease in humans in numbers clearly in excess of normal. But given the conditions and the lessons that we learned, and as well as the gaps in the responses that were done during the COVID-19 pandemic, the global community is now actually considering a redefinition of what a pandemic is. The WHO international negotiating body, which determines if a public health concern, an outbreak or an epidemic will be declared as a international public health concern, is now drafting the WHO Convention, Agreement, or other international instrument, or WHOCA+, of prevention, preparedness, and response. And in it, they're trying to propose this definition of what a pandemic is. For them, or for based on the new document, it defines pandemics as the global spread of a pathogen or variant that infects human populations with limited or no immunity through sustained and high transmissibility from person to person, overwhelming health systems with severe morbidity and high mortality, and causing social economic disruptions, all of which require effective national and global collaboration and coordination for its control. So what makes it different from the traditional or previous definition of the WHO is that it identifies the causative organism as something that the global population does not have immunity to. Because if a pathogen, if a community already has immunity to the pathogen, then it will not cause a major disruption in the systems of a government or of a community or a society. But if the pathogen is new to the whole population, it will cause sudden increases in morbidity and mortality. It also highlights the importance of transmissibility of the pathogen, because if a virus isn't easily transmissible, then it would not cause a high number of cases from the said disease, causing social and economic disruption. So that's a major change on our understanding of what a pandemic is. So based on that, that explains why COVID-19 was the only disease that was considered as a pandemic by the international and the intergovernmental negotiating body. So question, as a representative of your organization, do you consider, so now that we have discussed what a pandemic is, this was a discussion between Jeff and I when we were planning the webinar. As a representative of your organization, do you consider the COVID-19 pandemic as a disaster? Why or why not? Maybe you can ask Jeff first.
I mean, based on the definition of the pandemic, at least the working definition now with the negotiating body, that if it causes severe economic and social disruption, then I think it can be considered as a disaster.
It can be, based on your perspective. How about the others? Can you call someone?
Paul has a question.
Sure.
I wonder if it's relevant. So, what constitutes a pandemic? But I think this already has been covered in your previous slide. What level and to what level preparedness comes in?
Okay, we'll be discussing that second part of the question later.
Okay, so going back to your question, Jerry, what about the others? Do you consider COVID-19 pandemic as a disaster or not? You can just use the chat box and say yes or no. Okay, Chamroon said yes, it's a disaster. How about...
Why do you say that, Sok? Why do you say that?
Chamroon, why do you think it's a disaster?
No, maybe because it not just only affect yourself, but also it affect everyone. You know, big man, small man, whatever. It is not just only one particular group, one particular country, but you know, it affects not just human health, but also linked to economic impact, linked to many things, you know, because of disaster, depression, you know, and it requires a solidarity. That's why disaster, I said, because it just not let's say Cambodia have vaccine, but it will not safe for Cambodia, but it require other neighboring country should also have vaccine as well, so then everyone will be safe. Because if just safe for Cambodia, Cambodian people will not be able to get outside, we just stay there, so that's what I mean disaster.
Thanks, Chamroon.
Yes,
It's
Chamroon.
also similar to what others are saying. Baila said it's a global disaster. Okay, this one is interesting. Florida said it's a disaster because we were prepared. I think that we were or we weren't prepared for it.
Can you clarify that, Florida, please?
On floor, what can you clarify your answer? You can open your mic, but others are saying quite the same. It destroyed economic systems. It infected all systems. Okay. So what Mom Flora is saying, if we have foreseen it and we have a ready response, then maybe it would have been not as disastrous. It made everyone in shock. That's what Shamron is saying also.
Okay, so I think we have an agreement that the COVID-19 pandemic was a disaster for all of us. And I think a major factor in us saying that it's a pandemic is number one, the scope that it affected everyone, and it caused a serious disruption in our daily lives and our daily functions. And Paul says that it disrupted the current health system. Thank you for all your inputs. So now we'll discuss, just to end the debate between, no, not the debate, but the discussion between Jeff and I, if it was a disaster. Let's discuss what a disaster is. What makes something, or when does a disaster happen? I can.
Just
So
to time check, Jerry, we're already
Okay.
50 minutes past the hour, so
Sorry.
maybe around 10 minutes. That's okay.
All right. So pandemics, are they a threat or are they a disaster? The WHO defines a disaster as a serious disruption of the functioning of a community or a society at any scale due to a hazardous events interacting with conditions of exposure, vulnerability, and capacity, leading to one or more of the following: human, material, economic, and environmental losses and impacts, which you all have described earlier. So for a disaster to happen, so a pandemic is not necessarily a disaster. It is a hazard or a threat, but it can cause a disaster if it interacts with the vulnerabilities of a population and a society and the capacities of that population to absorb the impacts of the hazard. So the COVID-19 itself, the disease itself, is not a disaster. But since it interacted with a system that is not prepared to handle it, then that's the reason why a disaster happened in the last 3 years. But what prevents a hazard from becoming a disaster? Let's just skip this. What prevents a disaster from happening? It's risk management and preparedness. So the goal is to develop systems and societies that are resilient against pandemics and other threats. But what is resilience? The World Economic Forum defines resilience as the ability of an organization to overcome external shocks and grasp new opportunities in their wake. They define four stages when we encounter shocks and hazards or threats. The first is the preparedness of the health system to shocks. The second is the actual shock onset and the alert. The third stage is the shock impact and its management. And the fourth stage is the recovery and the learning from the shock. The World Economic Forum further defines or describes resilience in terms of 5 dimensions. Operational resilience, referring to the continuity of your services and your operations even during that event of the shock and after it. So the goal is to continue your operations while the shock is happening, while the threat is happening, and the responses to the threats are happening. The second is strategic resilience, which is the ability to respond to changes in the economic, social, and political environment. So this is highly connected to your operations resilience. You have to determine how to continue your operations despite changes in the guidelines, the protocols of your outside environment. Then there's financial resilience, which focuses on the resources of the organization, whether it be a society, whether a small civil society organization, to fund its services despite the additional stresses of the threat, or in our case, a pandemic. Social resilience, which refers to the degree of dependence on and interconnectedness with the social and political resilience of the communities in which it operates. And then organizational resilience. This means, as Jeff earlier said, there might be needed adjustments in the organizational structures, as well as the personnel working within the organization to provide your services and do your own businesses. Applied to health systems, Crook et al. Define health system resilience as the capacity of health actors, institutions, and populations to prepare for and effectively respond to crisis. Again, maintaining your core functions when a crisis hits, and informed by the lessons learned during the crisis, reorganize if conditions require it. But how do we become resilient in face of a disaster or a hazard risk? Again, a hazard doesn't necessarily have to become a disaster. It comes from the interaction of the vulnerability, the hazards, and the capacities of the communities being affected by it. Resilience comes from readiness. And the readiness to face a disaster comes from risk management and risk preparedness. Disaster readiness is the ability to quickly and appropriately respond when required. But one only becomes ready if you manage the disaster risk before the threat happens. And that's part of disaster risk management. Disaster risk management is the application of disaster risk reduction policies and strategies to prevent new disaster risk, reduce existing disaster risk, and manage residual risks, contributing to the strengthening of resilience and reduction of disaster losses. So what makes a health system or an organizational health system or health organization resilient? One is awareness, which is refers to the recognition of its capacities and the risks that it will face. Mobilization, its capacity to mobilize and coordinate resources and support even before the threat happens. Regulating, self-regulation, which means the ability to make required decisions in response to threats when it happens already. Integration with higher levels of management and higher levels of government, especially in the case of pandemic, which requires national response and international response. Diversity, a resilient health organization or health system is able to provide the range of services needed despite the limitations provided by the threat or its necessary responses. And lastly, a resilient health system organization is able to identify and apply the lessons from the shock. But how do we make health systems resilient? How do we make health organizations resilient? This is I think this was the question from Paul. Where does engagement come in? Well, disaster risk management involves 5 phases. One is prevention. These are activities, measures to avoid existing and new disaster risks. The second is preparedness, the knowledge and capacities developed by governments, response and recovery organizations, communities, and individuals to effectively anticipate and respond to and recover from the impacts of likely imminent or current disasters. These two happen before the actual threat is faced by the organization, by the society, or a group. Once the disaster, hazard, or threat occurs, then you will do the third phase would be the response, which is the provision of emergency services and public assistance during or immediately after a disaster. And then lastly, when the threat is done or is removed, we have recovery and rehabilitation, which is focused on improving the livelihoods and health and restoring basic services. But underlying prevention, preparedness, response and recovery, and rehabilitation is disaster risk governance, which is the overall system of institutions, mechanisms, policy, and legal frameworks, and other arrangements to guide, coordinate, and oversee disaster risk reduction and related areas of policy. I will not discuss this anymore, but to answer the question, which is, I think, the most important question in this discussion is, when does civil society or when do communities enter disaster preparedness and disaster management? As you can see from these framework from the WHO after the COVID-19 pandemic started, this was released in 2019. They recognize the importance of, let's skip that, I'll just show it here. There's another slide. The importance of community engagement in terms of coordination, planning, financing, and monitoring. There's a separate document from the WHO as well as OECD and the Lancet that states that community engagement should be started even before a pandemic happens, even before a threat happens, because people living in the community are the ones facing the threats and who know the threats that may be hazardous to them. So before we go there, what are the lessons in terms of strengthening health system resilience? Because this will answer Paul's question. Thomas et al. In an article that they presented to the WHO and which the WHO adopted, found 4 major groups of areas where strengthening health system resilience can be done. One is the first would be governance, and they say that effective and participatory leadership with a strong vision and communication is required at all phases of disaster risk management or pandemic management. Coordination of activities across government and key stakeholders is also a key strategy in strengthening resilience, so that local health systems as well as institutions on the ground don't have to make adjustments late when the pandemic happens. So committee members should be participating from the earliest stages of policy and program formulation to help clarify local priorities and adapt national and global policies to their local communities, help clarify challenges and pathways for practical and sustainable actions, and facilitate meaningful engagement of all minority groups. In my experience as the only doctor in the municipality or town where I work, even at the start of the pandemic, even before the lockdowns were announced in the Philippines, we engaged the community health workers as well as the local political leaders to discuss what will be the necessary adjustments once the pandemic happens, which allowed us to facilitate strong interactions in terms of identifying possible cases, tracing contacts, providing the vaccines to the smallest towns and farthest towns in the community. Other strategies recommended by Thomas et al. Includes organizational learning culture that is responsive to crisis, effective information systems and flow and managing infodemics, surveillance enabling timely detection of shocks and their impact, which requires feedback from the ground and from communities. For financing, they are suggesting ensuring monetary resources for the system and flexibility to reallocate and inject extra funds. Ensure stability of the health system funding through counter-cyclical health financing mechanisms and reserves such as disaster funds, and purchasing flexibility and reallocation of funding to meet changing needs and comprehensive health coverage. In terms of resources, there should be appropriate level and distribution of human and physical resources, ability to increase capacity to cope with the sudden surge in demand, and we should have motivated and well-supported workforce. And in terms of service delivery, there should be alternate and flexible approaches to deliver care and services. Vulnerabilities of particular communities and groups should be mapped so that they may be addressed. And at the end of it all, we should always recognize and address structural inequalities. But these are suggestions at the level of communities and the national and the country government. We should remember that pandemics are national and global in nature, which requires effective national and global collaboration and coordination for its control. So what are our instruments that we can use to ensure that we are able to participate in decision making and governance at the national level or international level. So APCASO released under the Global Fund released a toolkit to help you identify how to engage in pandemic prevention and preparedness and response at the level of the national and global communities. So we identified 3 documents: the International Health Regulation of 2005, which is undergoing amendments after the lesson from the COVID-19 pandemic; the WHO CA Plus, or the pandemic instrument, which is still undergoing development and which will be released hopefully by this month, October; and then the UN high-level meeting and political declaration for pandemic prevention, preparedness, and response, which Jeff will discuss. So since this will be mostly will be discussed by Jeff, I'll just be ending with this quote from the Human Development Report in 1994. In the final analysis, human security is a child who did not die, a disease that did not spread, a job that was not cut, an ethnic tension that did not explode in violence. Human security is a concern with human life and dignity. And the pandemic that happened was a human security threat that did not only become a threat but turned into a pandemic or a disaster. And we cannot dismiss any disease right now because the US CDC says, in today's globalized society, a disease threat anywhere is a disease threat everywhere. And in terms of pandemic governance and management, as the saying goes, a chain is only as strong as its weakest link. The WHO recognizes it and says that the success of health, emergency, and disaster risk management relies on joint planning and action by ministries of health and other government ministries, the National Disaster Management Agency, the private sector, communities and community-based organizations, assisted by the international community. At the core of effective health EDRM are efforts to strengthen a country's health systems with a strong emphasis on community participation and action to build resilience and establish the foundation for effective prevention, preparedness, response, and recovery from all types of hazardous events, including emergencies and disasters. I'm sorry it took my time, but Paul, I hope that answered your question on at which phase of disaster and pandemic management can communities or should communities and organizations engage with the government. Thank you.
Thank you so much, Jerry.
Sorry, that was a very long discussion because the CELG is a very layered project. So, but yeah.
No worries. That's really helpful. Most of us who are here have been working on HIV, TB. Some of us working in malaria also. I don't know if I can speak on behalf of everybody. We haven't had any such orientation on the pandemics and how it really relates into everything around health, public health in particular. So I hope our participants have really gotten something out of the presentation. It is lengthy, but I think the length is really needed to really provide that insufficient grounding for us to better understand what is a pandemic. No, most of us who are from community and civil society have just been pushed into participating in public health response without really understanding the concept itself. So thank you so much for this. Okay, well, we are a bit behind time, but in my next presentation, I promise I only will need 5 minutes for this. This particular presentation is to give you all a peek as to what the countries have actually committed so far as pandemic prevention, preparedness, and response is concerned. This will be the national framework that countries will be implementing from now until 2026. Insofar as United Nations is concerned. I'll go through the slides very, very quickly so that you'll get the idea. Again, I will not present this in detail, but I'm not sure if I can, okay. Okay, I hope you can see the screen. So I'll just go through it very quickly. I'll upload this later on the website and share it with you along with Jerry's presentation so that you can actually use them. So this is the PPPR Political Declaration 2023. No, when we say PD Political Declaration, it has a total of 78. It has a total of 78 paragraphs. Some are 29 are the preambular, setting the context paragraphs. The 48 are the operative, which means the commitments aspect of the political declaration. It's 14 pages in total, and these are the contents. What is the political declaration saying when it comes to some of the issues and priorities that we are pushing for? When it comes to recognition of communities and civil society, it really focuses on training community health workers and a broad text around community participation. It has specific focus on the role of women, especially women health workers. It recognizes private sector. It recognizes the whole of society approach, and it also acknowledges strengthening local and regional production of vaccines, of treatment, and other paraphernalia and medical products. So in terms of the overarching principles, it's all there. With regards to specific aspects of the priorities and issues that we are focusing on, so in terms of strengthening systems for health, Jerry already mentioned about the changes in the health system that will take place. We saw in the political declaration that there won't be any specific national response on pandemic preparedness. It will be integrated into the existing systems. They will definitely introduce new laws, but it's more of strengthening the current health system. There's not going to be a separate vertical system, vertical programming for pandemics. And then again, it recognizes civil society organizations. This has been a learning from HIV, TB, mainly, and partially on COVID, specifically around service delivery. When it comes to health innovation and technology, so this will involve research and development. So they've recognized the promotion of transfer of technology, but on mutually agreed terms. So what this means is, in the case of COVID-19, it was the global north who first developed the vaccines, right? And countries, especially developing countries, have to wait for the vaccines to become available unless they have deposited sufficient money to reserve sufficient vaccines. That was the process during COVID-19, if you all remember. Under this PPPR political declaration, both the manufacturers, either manufacturing country or private pharmaceutical company, and developing countries would have to agree on mutual terms. And there's a push to increase global supply, but then again, transfer of technology, meaning if a global north country will have to transfer information about the pathogen to be able to develop vaccines to the global south countries, to developing countries such as our countries in Asia Pacific, then they have to agree. What kind of pathogen will be developed, will be shared. It cannot be everything. So there's that caveat there. They will leverage TRIPS flexibilities also to make sure that generic can be produced in a state of a pandemic. In terms of involving different communities, I've said it in the previous slides already, the more focus is on governance, which is actually good, but then it depends on national context and priorities. So if your organizations are already engaged in the national HIV or tuberculosis response or other health responses, that's actually already a foot in the door. And they're also now focusing on One Health. We can discuss One Health in future webinars. In terms of inclusion of social protection, they did not have a really strong commitment around promotion of equity and social justice. They acknowledge it, but it's not quite clear in terms of how it will be integrated. No? They said that there should be a multi-sectoral approach to PPPR, but we don't really know what kind of setup will be in place in order to make sure that that will happen, and would also include social protection related mechanisms. This is what Jerry was mentioning earlier in terms of the economic impact brought about by pandemic. No? In terms of protective mechanisms for people who have been who are vulnerable to violence, abuse, attacks, and harassment, the current PPPR only focuses on health workers. This is quite critical and controversial because we've been saying that most of the communities that we know who have been locked down in their respective homes have become more exposed to violence and abuse. But the political declaration is only focused on health workers. So what does that mean in terms of the work that we're doing? In terms of integration of different approach, I mentioned this already, the whole of government and whole of society approach. They also recognize to strengthen HIV, TB, and malaria in terms of continuation of essential service, and also the One Health approach with regards to the inclusion of those who are working in animals specifically. In terms of social determinants of health, other determinants that impact health, again, there's not going to be a separate national response for PPPR. They will only strengthen existing legislative and regulatory frameworks already. So my assumption here is that the direction will really focus on UHC and PHC, or primary health care. In terms of financing, one of the essential health systems that Jerry mentioned earlier, countries would have to have an allocation specific to pandemics. We don't know whether that will be subsumed into current budget lines or a separate budget line for pandemic. But as a global community, there will be some funding pools already. They didn't mention pandemic fund in particular, but they would have an international funding pool as well for PPPR. In terms of naming the different populations, so you can see on the list on the screen, the different populations that they have recognized as far as the declaration is concerned. Some of these populations we're not currently, some of the populations that we are focusing on at the moment are excluded in this. So for example, prisoners are not here, migrants are here, which is good. The transportation workers, which is also part of the work that we'll be engaging in, are not here. So those other populations, would be nice to have a look at this again and see whether your particular population focus is part of this. Because if not, then what does that mean in terms of your country's engagement and preparation for the PPPR? Yeah. So what's next? Jerry mentioned this already. Well, so far as the political declaration is concerned, the United Nations, countries will be reporting back to the United Nations 3 years from now through another high-level meeting. And then this will heavily influence the ongoing negotiations on the pandemic treaty, the pandemic instrument that Jerry was mentioning. It will be adopted in May 2024 under the World Health Assembly. Also, the International Health Regulations, or the IHR, which is currently being amended as well to include definitions of pandemic, just like what Jerry presented earlier. So I will end my presentation there because we have some questions that we'd like to pose also. And because we've been talking too much already, we'd like to hear from you also in terms of your thoughts on these two presentations and how will this impact your work moving forward. So opening the floor now. Yes, Olide, go ahead. Please introduce yourself first.
Hi, Jeff. Hello, everyone. My name is Olaide. I'm working with Jana Foundation for the CLG work here in Nigeria, and we are focused on nomads and IDPs. So thank you for breaking down the HLM for pandemic preparedness. This is my first time of really understanding it. So I wanted to take you up on the issue of GBV that you explained, that that the HLM is focusing, or the outcome document is focusing on GBV for health workers. So does that mean that countries now have to define how they address GBV within their context, given that with COVID we saw a lot of GBV occasioned by the lockdown? How is that going to be addressed? How do countries report on that? What was the conclusion from the HLM on this particular issue? And then for the fact that I see that not all the populations that we're working with are mentioned, are countries now allowed to expand the list, or how does that work out? And how do we ensure that some of the last mile populations that we're working with are also not left behind in all of this, given that they are not mentioned in the document currently? Thank you. Over.
Thank you so much for those questions. So with regards to your first question on the experience of violence of the general population outside of health workers, that is really something that we need to advocate at the national level, and we need data to back that up. So I hope that your community engagement assessment report and the engagement plan that will come after that would include a specific focus on general population and how can we institutionalize the approach for general population, because right now the protection is only with the health workers. It's understandable, definitely, but for general population, as we all have known through the studies and the experiences of our communities, we would, unfortunately, it's not included in the political declaration. So we need more advocacy around that area as we implement our KELD. On your second question around the populations, there's a caveat in there that says it depends on the national, in accordance to national context. So that really opens that entire paragraph to include other populations as well. We can actually use that text to say that even if the populations that we're working with are not included in that list, eventually when they hold the high-level meeting 3 years from now, we already have the projects implemented already under this KELD project to show that they are missing these populations, and we can use the data, the activities that we've implemented to support that advocacy moving forward. So really going back to the advocacy work as an essential part of our work to make sure that the government, our government, are aware of the work that we're doing. Olive has a question in terms of health workers, what could be done to integrate CRG in their work? So if we break down CRG in particular, Olive, it's fairly covered in the declaration. One of the weaknesses, however, is that there's no concrete target. For example, when we say community engagement, are we looking at decision-making tables? Are we looking national pandemic governance committees? There's no such formulation. So countries really have to translate it. And as community and civil society partners, we either guide the countries on how they develop these working groups or these groupings, or we advocate on what our priorities are to make sure that possibly there's 2 or 4 seats for communities and civil society that we're working with. For the gender part, just like what we just discussed, the violence protection from violence for general population is unfortunately excluded. So we really have to do something in that area. In terms of human rights, this is the weakest as far as pandemic is concerned. They focused more on the technologies, which is good also, and the politics between the global north and global south countries, which unfortunately has severely focused on human rights. So the presentation of Jerry earlier, the freedoms that has been curtailed during the pandemic, we have to go back to that discussion again on how can we promote human rights in that context. We all know that most of our populations have either been criminalized again because of COVID-19 or has been disenfranchised during COVID-19 because of our condition, our background, and because of who we are. Okay, I'm fully aware that we have 9 minutes left, so I'm giving the floor back to Jerry for us to answer some of these questions. This is in relation to the questions in preparation. If ever there will be another, a continuation of this KELD project, what are the different aspects of the work that we need to ask first so that we'll find the answers? Jerry, over to you.
Yeah, and these questions will also help in designing the next sessions or the next webinars. So we just have to, actually there's 3 questions, but I think this will be important. The first 2 questions will be more important first. Kindly just answer through the whiteboard so it's easy to document as well, but you can also discuss it. The first question would be, what opportunities, remember in the past, in my lecture, there are 3 processes and documents that are being produced. One was produced already, the high-level meeting political declaration as discussed by Jeff. Then we also have the WHO pandemic instrument. In your own countries, the question will be, what opportunities exist that could facilitate your engagement in national platforms and processes, particularly in terms of pandemic governance. But if there's nothing specific about pandemic governance in any platform, what will those be? And then if there are available platforms, if you're able to identify them, who do you know are currently on these platforms, and what could be done to develop their engagement mechanisms so they can include the most impacted communities? So is the whiteboard visible to everyone? And okay.
This is the first time I'll be using whiteboard also, Jerry, so I'm quite curious.
So maybe yeah, we can start answers. At your level, Jeff and Rachel, are you familiar with the platforms in the countries that you're working with?
From my end, under this skilled project, the pre-validation forums that will be conducted it's still an abstract platform, but we can start a more formalized platform from there, no? Because this will be the partners that we will be working, who we will be working with for the KILD and in the implementation of the projects. The activities under this project. Let me write that down. How about you, Rachel? Well, the lady said, if I can just open this. CS co-representatives in the CCM. So the country coordinating mechanisms who represent their respective constituencies in the Global Fund country coordinating mechanism. Sorry, there's the civil society organizations who represent themselves in the country coordinating mechanisms is an opportunity also. For Shine, we have a network member in the platforms like CCM, so quite similar to what Oleida was saying. Local health boards and regional coordinating mechanisms. I believe, Shine, that you will be working with local health boards also, no? For your specific population.
Yes, we hope to work with them.
But in these platforms, because you will be working with tricycle drivers, local transportation drivers, have you encountered any local health boards or any health related platforms that have included local transportation, or it's very transportation specific and not health?
There are a lot of CSOs or NGOs working with them, but I think the local health officers are aware of them and their vulnerability to TB, for example. But we'll know better once we'll gather all the data after our research. So
Yep.
not so sure yet.
Thank you. I'm pasting polls as well. Shall we move on to the next question, Jerry?
The last question would be, I'll just type it.
Okay.
What are some of the main activities that will be included in the National Engagement Plan? So we're aware that you're supposed to be planning national engagement activities for your last mile populations. Given the platforms that are available to you in your country, what are the main activities that will be included in your plan to engage these platforms?
Let me move this question closer. So this is anticipation of this is anticipation of the engagement plans that you will be developing with your other stakeholders. I understand that all of us are still in the stage of late data collection or early analysis already, and some are already writing the reports. But in anticipation and based on the data that you've gathered so far, what are some of the activities that we can assume that will be included in the national engagement plan? If you can share them with us via chat or through the whiteboard on the screen. Do you already have an indication of what these activities would be? From what Ma'am Flor was saying earlier, there should be courses for decision makers to teach them how to give importance to the opinions and ideas of the community. So let me include that here as part of the main activity. I think that would be, this was also quite similar to what Chantorn was saying earlier, chatting with me privately about having a pandemic 101, a similar one that you just presented, Jerry, to the government representatives. Okay.
I'm interested, in your own countries, do you have legislations or national policies that legislate or integrate community participations with civil society organizations in policy making? Not necessarily just about health, but in general.
From what I know, most of them are on health.
They are
It
on
would
health.
be nice to, or at least linked to health. Okay. Right. Thanks for this, Paul. Yeah, there's a parliament. So in the context of TB, there are some what do you call that? Like national TB caucuses. But again, it's very specific to health, no? Let me put that as an opportunity as well. Yes, thank you so much for that, Paul. Parliamentary TB caucuses.
Is this everywhere or is it in a particular country?
There are particular countries that have national TB caucuses. Yeah. All right. I am aware of the time, Jerry. So I think this discussion will not end here.
These will be discussed in the next 3 webinars, and these will be posted again. The questions will actually be posted on the website again if you want to continue. And our presentation, we will be posting our presentation as well in the website so that you can review them. I will be posting my references so that you can see the nitty-gritty and the details of disaster risk planning. For pandemic risk, pandemic management and planning, there's still no particular document. We're still working around the framework of the WHO on health emergencies and disasters. But I'll be posting my references later.
Thank you so much, Jerry. So I see there still are some mouse movements on the screen. So again, thank you so much, Jerry, for the presentation and the inputs. This discussion will not end here. And also, I hope you get to have a feel already of what this lessons webinar would look like. Now, this is really more of a learning or a teach-in approach for us to strengthen our knowledge and awareness about pandemic and how to translate that into the implementation of the activities that we are implementing. Thanks also to Olive for supporting this. I really find this really helpful also. And not only personally, but also as part of someone who's working who've started working in PPPR as well. This will definitely not the end of the conversation. Some of this conversation we will move to our discussion forum, so please do register to our KELG Learning Hub. You will also find all the materials there. And don't worry, you will see the materials. I'll send the notice either via email or through our MailChimp newsletter specific on the KELG Learning Hub. So please watch out for that. So thank you again. Jerry, final words.
Yeah, so for the next webinars, for today, we discussed the frameworks and the lenses that we can use in determining how to strengthen inclusion. For the next sessions, we'll actually be talking more about your experiences and lessons from the COVID-19 pandemic and how it affected your processes. And we'll be learning more from each other. You'll be talking more instead of me and Jeff. So I'm excited, looking forward to hearing your lessons so that I will learn more about how things are done in the ground in other countries.
Jeff, one thing I
Yes,
just
sure.
want to include. Yeah, thank you so much, both Jerry, Jeff, Rachel, and everyone else. I want to challenge you, Jeff and Jerry, that we all should, by the end of next month or by the end of this month, know how to use the whiteboard. That will be a very good start, and I think that will improve our conversations.
Yes.
So maybe we should have a whiteboard specific session. I don't know when, so that when we're having our conversations, it becomes much easier. But kudos and well done.
Thank you.
Thank you so much, everybody. Bye for now.
I will see you next.
Thank you. Bye bye.
Bye.
See
We
you
hope
next
to meet
webinar.
again. Make
Yes.
sure that you share all the presentations. We are waiting for them.
Definitely,
Thank
Paul.
you.
Will do.
Bye.
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 You, bye.
Thank you. Okay. Let's wait for the others to. Okay. I'll now close the. Yeah, stop the recording. Wait lang, Jerry, ha?